I'm the chairman of the Department of Emergency Medicine at the University of Cincinnati College of Medicine. And my department sees medical emergencies all the time. The thing about these emergencies, though, is that the story is often told by the time the patient arrives to us. We are the final step in the chain of survival, and if the patient receives inadequate care prior to their arrival with us, their chances of a positive outcome are greatly diminished. The benefit of proper care at the outset of an emergency, say an adverse reaction to a medication you administered, is infinitely more valuable than the care they will receive by the time they reach the emergency department. It is up to you as a medical professional to ensure that the story of their survival has a proper start. We often hear it isn't necessary to have emergency supplies on hand, but it only takes one occurrence, when you're not ready, for the repercussions of an emergency to leave a permanent impact on the lives of your patient, your patient's loved ones, and yourself. Calling 911 during a medical emergency will provide swift aid, but it is not instant, and you can help their survival tremendously in the intervening time. To be able to respond in the best manner possible, I recommend that a medical practice have an emergency medical kit with up-to-date drugs and devices appropriate to the level of care that you are able to provide. An AED, portable oxygen, training and basic life support, and the practice with all of these supplies on hand will greatly help. If you are not comfortable with providing certain levels of care, like intubation or advanced cardiac life support, there are emergency medical kits that can provide more basic forms of care. So there should never be an excuse of not knowing how to use the drugs and devices necessary to save a life. Epinephrine autoinjectors, Narcan nasal spray, and bag valve masks are easy to use, but can make a huge difference in the likelihood of survival for your patients experiencing a medical emergency. As a doctor and the recipient of sick people, I can tell you that they often do not know just how sick they are. And they all too often turn to a medical office for help that is best rendered in a hospital. You need to be ready for that. The community sees you as a resource during an emergency. We recently heard a story of a man rushing into a medical office to help because his girlfriend was overdosing outside in the parking lot. That story has a happy ending because the medical office in question was ready to respond, providing care and activating 911 immediately upon understanding the situation. Emergencies are rare, it's true. But can you imagine someone asking you for help during an emergency and you aren't ready? It only takes that situation occurring once in your career for the consequences to follow you for the rest of your life. Be ready.